be formless, shapeless.
Hope it's a little more focused. I literally just recorded a video and I looked at it and it was trash. So anyways, I'm gonna do another one. Anyways, Cord here with No Meat Geeks bringing you another video. Be sure to subscribe. We're definitely gonna keep the nursing videos and random stuff going on in our lives. Gonna keep them coming. So earlier, about 10-15 minutes ago, I did an unboxing of this Pharm Flash. You know, I got my wrapper and stuff right here. I literally just did this video, but it was blurry, so I'm doing it again. I got a new camera, so not even necessarily new, but I was kind of tired of using my iPhone. The quality was kind of crappy. So I got a new camera. It's a Sony. I've had it for about 3-4 years now, so it's not the newest camera, but the quality is definitely shitting on what I was just using. So it's just me today. I definitely want to bring my girl Monica on so we can do a video together, you know, a couple nursing type of thing. But we're both pretty busy, so our schedules sometimes don't sync up the way I like them to. So one thing I did have on the other video is there's still great people out there. So I work in a call center. There's a lady there that graduated from nursing school about a week or two ago, passed her NCLEX exam, got her license and everything. So congrats to you, Stacy. And she also blessed me with her books that she used. So you gave me these intravenous medications, critical care nursing, NCLEX exam review, understanding pharmacology. She also gave me some notes and a couple other books, but definitely just wanted to say thank you and know that there are still good people out there. What's next? Oh yeah, I also just finished up my clinical labs yesterday, so that was pretty dope. Had my lab tests. So generally we have like checkoffs where they'll be like, okay, you have 3 skills, you do this skill, okay, in the skill, we do this skill, in the skill, do this skill, in the skill, and that's the end of it. This time it was more like a simulation. So we actually had our patient and the orders that the doctor had written. So my lady was post-op after a bowel resection. She had a tracheostomy for 10 years. I was pretty much getting ready to leave. You know, I was DCing, my orders were to DC her Foley catheter, change her intravenous infusion to saline lock. So I was doing my vitals and I was listening to her breath sounds. I heard her wheezing, and then she started complaining that she had a hard time breathing. In fact, she had mucus in her chest, so I had to do sterile suctioning on the tracheostomy she had, and I also had to do a dressing change. The only thing I did get checked off, or I got counted off on, was when I went from the dressing change to taking out the Foley catheter, I left the same gloves on, but everything else, she said, my professor said I did pretty good on. But what happened was I was in the middle of changing her dressing, and the professor comes on, you have 5 minutes. We had 30 minutes total to do the lab, and I'm just like, oh. So I had to hurry up, get the Foley catheter out, change her to saline lock, and she also had to be on a clear liquid diet, so I had to explain to her that she can't have any coffee or orange juice, which is what the patient was asking for. So it's just because I had to rush. I swear, I would have made 100 on there. But anyways, back to the business. So Pharm Flash, Pharmacology, Flashcards. I need these because I am struggling with the drugs for some reason. Like, it's been some of the hardest things for me to learn how to do this. So while I'm at work or just whenever I'm just hanging out, I'm gonna look at these flashcards. And here, I want you to take a look at it with me. Pharm Flash, and it says based off of Davis's drug guide. So let's see what it has in here. We're gonna look at the good, the bad, the ugly. So it looks like they have the drugs separated by systems of GI, endocrine, neurology, immune system, musculoskeletal, central nervous system, respiratory, so cardiovascular. That's what I'm on right now, and that's what I'm struggling with. Respiratory, sensory, and then just the index. Okay, so let's look at what the kind of tight. So we pulled out one of the cardiovascular cards. Looks like they even have the pronunciation on there. 𝐼𝐧𝐻𝐿𝐼 𝐾𝐻. 𝐿𝐼 𝐾𝐻. And then they have the scientific name underneath it. They even show you it's a heart drug, so that's probably gonna be good for memory. Direct thrombin inhibitor tells you exactly what kind of cardiac drug it is. So on the back here, looks like we have therapeutic class, indications, action, adverse, and side effects. Looks like they should be in a little bit more. The thing that confuses me sometimes is adverse reaction and side effects. They're different because adverse is a lot worse than just a side effect. Some side effects are pretty normal. So I kind of have trouble deciphering. I think I really want to rather know what the adverse effect is than just the side effect. But the side effects are good for patient teaching. So you see, keep in mind, looks like they have make a connection, which looks like kind of the things you want to assess for before and while you're giving the drug. Now one thing that I do see that they're missing on here are other drug interactions. So what drugs can you not mix it with? So that's something that I wish was on here, but you know, beggars can't be choosers. I can use this and look at some good info on here. Let's take a look at another. Atropine. I know this one. I know this one. Say exactly what kind of drug it is, where it's working on. Same thing. So looks like it'll be a lot of help. Let's see. Again, there's just all the systems it works on. Okay. So hopefully I can get this thing back in focus and it's not all blurry again, but even if it is blurry, I'm just gonna upload this because I don't have time to be making 3 videos in a day. Okay. So I got this for $33 at Barnes & Noble's 2 days ago. I know I saw it on Amazon for $31. So, and then that probably would have been plus shipping and handling, so it probably would have cost about the same. So today we are going to start packing up because we have closed on it. Well, we haven't closed, but our offer was accepted on a new property. So all this is going to be changing here within about a month or 2. So I got to start packing. Got to study some more, of course. And I will bring Mon on one of these videos here soon. Again, our schedules don't mesh up well, but we will definitely be on here together coming soon once we do get a little more free time. So again, subscribe, leave a comment, like, do whatever you do, and we'll bring you another video soon. Peace, people.
Be formless, shapeless,